that helps us isolate the census information it needs. So for nursing in particular, we know that depending on the shift and the census, the number of patients that are in our particular floor or department at that certain time, what the mix needs to be. And based on that mix of head count, it's driving our staffing grid here to help us isolate where things are going to be. So as you can see, you can actually go through here and have all of them broken out as necessary. Once again, this is customizable based on your organization. And what we've done then is been able to bring it all back together in total again with another recap here. This is just for labor, in this sense allowing us to see all the different components of the labor come together and how much at more of a GL level line how things are looking and how the numbers are going to come together for final viewing. And then finally here is that concept of other expenses and other revenue. So this is an area that tends to fall by the wayside. As we talked about, the salary planning is incredibly important. We know that the revenue side of things and the reimbursements are definite levels of detail that you go into and deal with within a provider, but there's also this other set of expenses. And the approach we've taken in this accelerator is to give them a standard planning method and allow that planning method to help spread this expense across. Once again, we've tried to pre-fill it as much as possible from a global perspective, either taking current year forecast or upping the forecast based on a certain percentage, putting in overall cuts across the board if necessary to give a starting point, and from that starting point using a method to try and spread that information across. But for example, here right now we have a fixed spread on account. We can actually change this here using this drop down to we can input a total number. So we'll see this is going to change on us here. I can put in the total number I want, and it's going to take and spread it based on a certain spread method. I can change that spread method if I wish. But this is just giving a department manager a way to take care of these other expenses without it being the cumbersome. I need to put in 12 months of each individual line item and input that information across the board, as well as I actually have an ability over here to input a comment. So what this is a textual comment that I can make in, and that comment will be actually saved and sent to the database. So not only will I be able to see that this change of method was used, but I can also see the comment back in reporting for future references when I couldn't remember why in the world that the office supply amount was changed or why it was spread differently last year versus this year. I hope this is kind of giving you a little idea about how we can actually do some of this more detailed planning without it being the cumbersome task of putting in number after number after number, and really using the concepts of BPC and logic that you can build in here to use the driver-based approach. Now, one other area I want to show you that is key to the planning methodologies for healthcare providers is this reimbursement model. And really what this is a bridge almost, bringing us from our GL level information, which we've been planning up until this point, now through a reimbursement model, which is really looking at the patient type and how the patient types help drive some of this information into the system. So some of the key considerations when you're doing this reimbursement modeling is that budgeting for net revenue is often a process disconnected from the volume and department level planning. So we want to be able to say, if it's disconnected, how can I bring it back together? And then unlike the department level planning, reimbursement modeling is typically done at the hospital level by financial class or payer, whether it's Blue Cross, Medicare, et cetera, and not necessarily by department. So it's a different look at things, but we're still trying to come together with that final number for this plan. And ideally, the volume assumptions and the resulting gross charges would be shared, but used differently depending on what the organization is. And in turn, the data is integrated more of a patient-centric approach. And if you want to see now, once again, we have that same view of things where we have a start page. I have a recap slide that once again will bring us through and give us some high-level information associated with these metrics that we're going to be planning for the reimbursement. So whether it's gross charges, department level budgets, net revenue, contractual allowances, et cetera. We have our drivers that are in here as well, admissions, patient days, gross revenue per admit, et cetera. And then looking at some of the key indicators driven by this information and being able to say, once again, looking at last year, current year, future, where the variances are and where we need to go make some modifications potentially. So I'm going to drive us now into the inpatient view. And so as we kind of talked about here is it really is one of those things where you view it by these major patient types. And patient types can be different within organizations, and this can all be, once again, customizable based on a certain organization. But this is an approach we took here. We're really looking at our inpatient versus our outpatient, really drives the differences here and how the reimbursement works. So what we've done here is taken and isolated this information into what we call a revenue application. That's just really looking at the information by a slightly different view. So if we look over here to our right, once again I have our current view here, it has slightly different dimensionality because this is really looking at from the patient side rather than the GL side. So slightly different dimensionality, but once again bringing together into a single system so that all this information can be bridged. And as you can see, we can see any bridge or difference here based on our GL reconciliation back to our revenue. So there are various reasons why there is, but this actually can help isolate and tag what those variances are and really give it one step ahead of being able to come back to the correct number. So we have that same view again where we talked about you can view it in different mixes and so on. And here we can actually see how we've broken it down into the different payer side. So being able to model that information and change it across the board. This template allows us to look at this by many, many different views. So if I wanted to look at it across a long spread historically, I can have the long spread historically. I can go in and I can change it to just the monthly detail. So I have different options here to really give me a robust view of the different information. And so even we can go in and modify things like, for example, this reimbursement rate. So if I can go in here and I can model the reimbursement rate, and as we talked about that it can be dynamically changed and modified as necessary here, and then broken down like we talked about, whether it's a need to break it down by inpatient, outpatient, etc., but really isolating some of this information here. Another option is the fact that we can actually change how this stuff is calculated. As we know, the different payers may have different combinations that they're looking for, so we can take and use that different methodologies here depending on the payer. And then finally is we actually have an ability to look at our Medicare information, which is usually calculated and stored differently. So in many of these reimbursement models, there are massive amounts of spreadsheets taken offline, calculated. Somebody's trying to come up with what the mix is going to be, what the admits are going to be, how long people are in the hospital, etc. This is actually allowing us to break down this pertinent information and store it all in the same central database as our GL information so that numbers can come together and be included. And then finally, I have one more quick thing to show you in this demo is I really wanted to talk about when you get to the end of the process, when we've got all our reimbursements together, we have our departmental budgets, all of those assumptions were set up to begin with, so everything has come together, we have it in one spot. There are times when one needs to do top level adjustments where you kind of come back and said, hey, we need to go back and modify some information. We've built into this Accelerator something that is incredibly effective at being able to go in and modify some of this information. So for example here, if I know going into here that the consulting fees that were budgeted need to be revised, I can actually go in, revise this information. It's going to go now spread this information based on, in this case, the prior year, back to the departments where it was originally budgeted. But not only is it going to go change the number in total, isolating what the original input is versus this change, but I can actually go in and also manually change information here. So if I have particular changes I want to do override based on the allocations, I can do that in this form as well. So it really is an ability to make this information from the top, the bottom, the side, all of the factors coming together to bring us to one individual area to come up with a number and report it back. That's my little introduction to the healthcare Accelerator. I do hope I've given you a good glimpse into some of the things that we have put together in here.